Hello and welcome to the clinic. I'm going to perform some medical tests on you today to see how you're doing. I'm also performing a little experiment where I listen to your heart rate before and after the tests have concluded to make a comparison to see what effects the tests may be having. So if you don't mind, just relax, sit upright and let me have a little listen to the chest. Breathe naturally to start with. Take a big breath in and out. Once more in and out. Excellent. Let me just record that down. Okay, we have some fabulous new equipment in the clinic. First up we have this little Minecraft colour palette here. I'm going to point to some colours. Let's get the lighting correct. I want you to tell me which colour you see on the palette, please. Just there. And there. And just where the tip is there. Good. And there. A little bit of a flip. What colour do you see there? There. And the second in at the top there. Lovely. It's a promising start on the palette. Right, I'm going to say some colours. I want you to pick the best match with the colours I read out. Let's bring the palette there. Okay. Can you point to royal blue, please? Which one you think is royal blue? Okay, and cerulean blue. Next is pistachio green. And point to a lemon yellow. Now Diablo red. Good. Charcoal grey. Zanzibar pink. And now point to which one you think is tropical brown. Lovely. Please point to your favourite colour. Point to the colour that makes you feel the happiest. And now the saddest. And which is your least favourite colour on the palette there? Excellent. So I've gathered a little bit more information about you there. Good identification with those shades. And I found a little bit more about your personality. Right, we're going to move on to all-in-one near chart for some more specific measurements. Let's have a little look. Okay, looking at the plates here, what number do you see on this one, please? What numbers do you see on this plate? And the numbers on the middle plate. Good. Same shades or different shades to the numerals there? Good. Are the numerals equally vivid or is there a difference in the intensity there? Good. Moving up to here, some words. Is the print clearer on the red or the green side, please? Red or green? Flipping round, a near chart here. What's the smallest block of print you can read down to? Okay, how comfortable is this to read? That's the N5 block of print there. Okay, let me try. Come to your rescue a little to see if the little hand magnifier here can help you to see better by magnifying. Okay, so we are N5, just here. Okay, how much of a difference does the little pocket magnifier make to the print there? Good. Can you read down to the next block of print there? I'll just shuffle along. Alter the working distances a little. Can you read the smallest there? Okay, good. Alright, we have a new all-in-one occluder here with measuring scales upper and lower and monocular types. So just looking off into the distance, I want to do a little cover test using the black side, using the white side, back to black, keep looking off into the distance. At one point, look into the distance at one point, please. Lovely, let's take some measurements. I'm going to come a little closer, using the scale vertically there. I'm going to have a look at the vertical aperture on the right. And the vertical aperture on the left. Lovely. Just look at one point, please, straight ahead. Going to check iris diameter. Lovely. I'm going to take a full pupillary distance measurement. Just look into this eye, please. Now to the other eye. Good. I'm going to rest this on the bridge of the nose. Just look straight through the window. And just across a little. So monocular measurements there, 32 and 33. Up to 65, marvellous. Right, you brought your bifocals into the clinic today. Here's the first pair. Got the flexibility. And this is the second pair here. Just want to take some brief measurements of the bifocals. Just bear with me. And the length to bend. Drop off there. Length to bend on the other side there. And drop off. And just checking the bifocal fitting guides there. Lovely. Lens size. Good. Let's have a little look at your round style. Okay, that concludes spectacle measurements. Everything's looking fine with that. Right, I want to check your central vision area. You seem to have good vision on the chart, but to cover your left eye, I want to do the Amsler test here. Looking at the spot in the centre of the grid, do any of the lines appear wavy? Do they appear to bend? Excellent. Okay, cover the other eye now. Looking at the spot again. Any distortion to those lines? Okay, all straight. Any missing areas? No distortion or missing areas. Excellent. Right, I have another vision chart I want to use, the Illuminated near vision chart. Let's find the right side. Okay, let's just check the illumination levels. Let's just get this in place for you. Okay, where do you see the break in the Landolt? See there? How about there? And there? Here? Here and here? Okay, don't worry if it's a bit too bright. Just where do you see the break there? Here, here and here. Good. Can you see this one? And the middle one? And you see a break on this one here. Okay, I need to have a good look at your ocular surface and the surrounding areas. I have a special device for doing this. Have a little look at these. Okay, these are the +2 armless magnifiers. I'm aware the sticker's on there. I'm just going to dim the lights. I'm going to place these on here. Good. Okay, looking straight ahead. Excellent. Okay, take a blink. Look up. Look to the right. Let's check the nasal conjunctival area. Look to the left. That is the temporal area. And look down. Look at the superior conjunctiva. Lovely. Just close the eye a second for me. So to look at the lashes and their direction. Open the eye, just look towards the finger. Okay, now evidence of any trichiasis. Lovely. Okay. Have a little look at the iris surface. Looking at the crypts, collarettes. Okay, and the other eye, just start by looking down. Look to the right, look left, and just down as I lift the lid. Good, so the redness is very low, looking up again. Let's check the inferior hyperemia levels. Good, look straight. Let's just look at the limbal ring. Okay, just blink. And let's look at the iris. Okay, a little bit of pigmentation pigmentation on the iris. Single freckle. Located at 6 o'clock. Right, that's marvellous, thank you. Okay, let me just take the remaining notes there. Excellent ocular surface. Just going to draw the eye out. And mark up the pigmentation. The iris freckle. The 6 o'clock region. I think I'm going to get that looked at on the slit lamp a little bit later. Alright, okay, that's the end of the tests in this room. As promised, I'm going to have a little listen to your heart rate to see if there's any difference. Okay, again, start by breathing naturally, please. Okay, big breath in and out, and again in and out. Good. Appears as though there's been a reduction in the heart rate, beating a lot slower. Excellent news there. Okay, did you experience any ASMR during the test? Okay, what level of ASMR? Scale of 1 to 10, 10 being incredible. Good. So you did experience ASMR. Did the levels vary at all, or did they remain consistently high? Excellent. That's that part concluded. Let me have a little look at you on the slit lamp. Just looking at that iris freckle.